we begin with a potential new weapon in the fight against the coronavirus. Merck has asked the FDA for emergency authorization of its pill to treat COVID-19. It would be the first pill if approved. Earlier this month, Merck said the drug cut deaths and hospitalizations by half among patients with early symptoms. This comes as experts say kids could be fully vaccinated for COVID by Thanksgiving. CBS News' Skyler Henry reports from Washington.
Merck has asked the FDA for an emergency use authorization for the first pill to treat COVID after clinical trials showed it helped save lives.
Dramatically, by 50%, reduce hospitalization and death. So an oral pill that works against COVID-19 hospitalization.
Current treatments such as Regeneron require patients to receive infusions. The Merck drug could be given at home, relieving the crush of COVID cases in hospitals.
As soon as it's FDA approved, we can start to prescribe it to patients rather than them having to come into an emergency room and be given intravenous therapy of an antibody or a shot of an antibody. They can get a pill.
Health officials say the new COVID treatment is exciting, but they say the best measure against COVID is still for people to get vaccinated.
We still have around 68 million people who are eligible to be vaccinated that have not yet gotten vaccinated.
Vaccine hesitancy is even greater among parents, debating whether their children should get the vaccine if the FDA approves it for kids 5 to 11. A new CBS News poll shows 35% of parents surveyed say they will not let their children get the vaccine. 26% are unsure.
I think there's a lot of information available. It certainly makes me confident about vaccinating my kids. And for those parents who still have a lot of questions, I would urge them to have a discussion with their pediatrician about the pros and cons of vaccination.
Politics is one of the key factors in whether parents will vaccinate their children, with 61% of Democrats saying yes and 56% of Republican parents saying no. Skyler Henry, CBS News, Capitol Hill.
For more on this, I want to bring in Dr. Cioe-Pena. He's the Director of Global Health for Northwell Health. Dr. Cioe-Pena, welcome. So what difference do you think this pill could make in the fight against COVID? And additionally, are there any concerns that if a pill is easily available to treat COVID, it may prevent some people from getting vaccinated in the first place?
Yeah. Hi, Tanya. Good afternoon. I think it's important, an important part of our armamentarium. 50% sounds like an amazing reduction. I still think that compared to vaccination, it doesn't really hold a candle in terms of the reduction in hospitalization and death. Vaccination reduces your risk of death by much more than 50%. But for those that, and as a clinician, I've seen lots of people that started to get vaccinated and then contracted COVID during this last spike in mid-vaccination. This is a nice thing to have in the tool belt that we can pull out. It is, an oral pill, which makes it incredibly versatile. We can prescribe it. We can have people take it at home. It doesn't require a kind of, an intravenous line or even a needle, which is incredible. But it's certainly no substitute for vaccination. I don't think anybody is saying that it is, but it is nice to have, knowing that for the unvaccinated, this is a way that we can reduce their hospitalizations or death. It's really unclear whether it would help at all against vaccinated people, and certainly for those that the vaccine doesn't work well in, like people that have severe immune compromise. This is a great option.
And former FDA Commissioner Dr. Scott Gottlieb, who's also on the board of Pfizer, says it is reasonable to believe we could see kids ages 5 through 11 fully vaccinated by Thanksgiving. How significant is that?
That's a game changer. I mean, that'd be great if it happens. I'm really hoping that it happens. As someone who has one child who's between 5 and 11 years old and another one that's almost there, I think this is great. It's certainly going to change the game in terms of risk for school transmission and spread. We know even now with kids not eligible that in-person schooling really is the way to go with kids, especially younger kids. They need the in-person schooling. Virtual options really don't work, especially when you get into 5-year-olds and the younger childs. So I think this is a great thing. I'm certainly excited for it and looking forward to it. I do think that some of the initial resistance is just because it's, these are national polls, and these aren't decisions that get made during national polls. They're decisions that get made in your pediatrician's office, talking to your pediatrician. So I hope very quickly we're able to move the discussions to that venue.
Right. You're referencing the polls, and I just want to fill our viewers in. New CBS News polling finds that while there are many parents who say they will get their child vaccinated, there are nearly as many saying that they will not. So are you concerned about children who are not vaccinated when it is available to them? And what would you say to those parents who remain skeptical? I know you said this is something that has worked out on a personal level with your pediatrician, but if you were asked by a parent, what would you say, Dr. Cioe-Pena?
Yeah, I would say look at the numbers. I would say look at the risk that a child has from a vaccine, from any vaccine. And look at the risk the child has from whatever disease that vaccine is designed to prevent. And the risks, especially when the prevalence is high, like coronavirus, the risks of the disease are far outweigh the risks of the vaccine. Now, I agree that coronavirus infection in younger children is much less risky than it is in adults with risk factors. But that being said, the vaccine is still several orders of magnitude safer than getting coronavirus. And every argument I've heard about the long-term safety of mRNA vaccines, I could also say we don't know the long-term safety of getting COVID, and we certainly have evidence that long-term symptoms from COVID are in the scope of possibility. So certainly you don't want to be one of the parents whose kid gets one of these complications that are rare from COVID, like MICS. But we also don't know what COVID infection could portend for later years. And we certainly know that in the history of vaccines, there has never been a vaccine that has caused complications years from the date of vaccine. It's just there's no evidence that that's ever happened in the history of the entirety of vaccines. And so we really are confident that this is a safe vaccine. And as I said, I have 2 kids, and I'm going to give it to them the moment they're eligible.
Well, Dr. Eric Cioe-Pena, thank you so much for joining us. As always, we appreciate your expertise.